Well, thank you very much. And thank you, Marcia, for arranging and helping coordinate this fabulous event and everybody else who's participated tonight. And thank everybody for coming out in this beautiful fall evening. I was talking to a colleague of mine up in Pennsylvania, and they were describing how beautiful the leaves were and changing. And as I looked out the window and saw the beautiful lush green, and I said, well, I know what's coming for you. We are delighted to have the warmth down here. So this evening, I'm starting off the evening and talking about pregnancy care. And a lot has evolved over the years. Some things will never, ever change. They're the same they were millennia ago, but there are some things that have evolved in how we actually care and manage for pregnancy. So we are stuck on slide number 1. It is a very important slide. So give us just a moment. That's just. That works. So, from an expecting perspective, what do you expect during pregnancy? Well, from the moms, you get helpful advice from your doctors and nurses. You get helpful advice from your family, and we all are family. You get helpful advice from spouses, and you get helpful advice from strangers. I don't know how many of you have had the experience or had a family member have the experience of being in the grocery store line and having complete strangers give you very, very helpful advice. I have a daughter who just delivered a few weeks ago, and she would regularly, every time we talk, I'd have her update me on the most recent story from the community. So what I want to do tonight is actually maybe give some helpful advice for those of you who have pregnancy in the community around you and your own individual family communities. So I'm going to discuss navigating pregnancy a little bit, and the stages of pregnancy, things to expect. I also want to mention briefly about midwifery care and the role that that plays in care, and also just really some new information that's really, really important about breastfeeding and the importance of it. So prepared childbirth is a bit of a contradiction because it's hard to prepare. There are multiple stages of pregnancy. We talked about the pre-pregnancy time, the preconception time, and then there's pregnancy is divided into 3 parts: first trimester, second trimester, third trimester. We have the labor and delivery time, and then there's postpartum time period. It lasts about 6 weeks after the delivery. So from the stages of pregnancy, 6 days after conception, the baby is just a fraction of a millimeter. Actually, the pregnancy is about a fraction of a millimeter. There is no baby at that time. And so by about 8 weeks in the pregnancy, the baby is only about 1 inch long. And then by 12 weeks, we're just under about 2 inches. And then by the time you reach full term, babies average about 20 inches in length. And so it's a continuum. There's very, very rapid growth throughout pregnancy. So the pre-pregnancy period is the time to prepare. And this is really important for family to be involved. So you collect your health records, you review the family information, because the care team is going to want to know what kind of experience family members have with pregnancy. They're going to want to know what health conditions may run into in the family. And so these are important for delivering very individualized care. And so when there are issues with health, medications, or risk factors, we want those conversations to happen before pregnancy so you can be healthy as pregnancy started. And of course, folic acid is really important to start at least 3 months before pregnancy if possible. Most multivitamins have that. And that actually helps prevent certain types of birth defects like spina bifida. So really the goal is to enter pregnancy in the best of health. We talk about a lot of things pre-pregnancy, from chronic health conditions to previous pregnancy problems, things that are important in a family that may be relevant to an individual's pregnancy, or a history of preterm birth in the family, or toxemia, small babies, miscarriages, stillbirths, or birth defects, labor problems even. So these are things that are relevant to a woman who is planning or going through pregnancy. And the medications, of course, are really important. So routine prenatal care involves a lot of blood tests. There's just a never-ending series of blood tests at various stages in pregnancy. There's, of course, the lovely urine test, which is rarely a problem collecting during pregnancy. At the visits, there's interest in how much weight the mom's gaining, blood pressure, the size of the uterus, and also a variety of genetic testing. When there's concern about the chance of a preterm birth, we also are able to look at the cervix by ultrasound to determine whether somebody's at a higher risk or a lower risk of having pregnancy, and that's relatively new. So the most important thing we do in pregnancy is actually set the due date. And we can do that, traditionally we've used the last menstrual period for dating, but actually ultrasound is often more accurate. And ultrasound in the first trimester of pregnancy is most accurate. And we really rely on that quite heavily. And this is actually what some of our modern ultrasound technology can do in imaging a baby in the first trimester. And it's pretty phenomenal, the detail that we can see. So some things to know: body changes immediately, right after conception. Nausea, we hope, ends by about 14 weeks. 6 to 14 weeks is the key time. My daughter reminded me that that's not everybody. And it wasn't until she delivered that her nausea went away. It's also important to know that most medications won't cause problems. We do recommend avoiding hot tubs and saunas because they increase the body temperature, which can affect the baby's development. Most organs are completely developed by 13 weeks in the pregnancy. And so it's the maturing and the development of the existing organs that happens through the rest of the pregnancy and through childhood into adulthood. I have been told that a child's brain stops developing right around puberty. That you could each verify that on your own. And we can screen for a ton of genetic problems that can happen during pregnancy. In fact, we can inform parents of risk for certain genetic conditions in their children that they've never even heard of before. And so it makes pregnancy a really interesting and challenging time just to absorb information. So when we do testing and genetic screening, mostly to reassure parents that things are normal, but occasionally we can find things that are a problem. And our screening is really designed for many things. So number one, our prenatal diagnosis may allow women to undertake a pregnancy that they might not otherwise have considered. We can often be quite reassuring. If we identify a problem, we can discuss parental options, such as what additional testing to get more information. Sometimes referrals to certain specialists are needed. Counseling about pregnancy management and what to expect is important, and preparation in some cases for a special needs child. And in some cases, it truly alters pregnancy management. And it also can change the management of a newborn after delivery. So all of these reasons are important to do these prenatal screening and diagnosis. You all have heard of blood tests that we can do now to determine a baby's sex, whether it's male or female. That technology was developed actually to be able to take blood from the mom to determine basic genetics of the baby. So many of you are familiar with amniocentesis and needle tests. to diagnose certain genetic problems. Many of these we can identify now with a blood test from the mom, and that's getting more and more sophisticated. It's pretty outstanding. But yes, that does deserve a round of applause. So in the second trimester, the baby grows a lot. It grows to 80% of its term length, and the uterus starts to grow above the belly button, and energy is supposed to improve. And it's the time for ultrasound screening, and most of course, what we do is reassurance and develop growth, look for growth and development, and of course, get fabulous pictures. Other things, bladder shrinks, of course, which any mom will tell you, posture changes. It's time to arrange the childbirth classes. And we get asked the question all the time, when is the earliest a child can survive? It's about 22 weeks in the pregnancy, which is just over halfway through the pregnancy. It used to be 32 weeks, then it got reduced to 26 weeks. Now it's about 22 weeks. It's pretty remarkable what we were able to do now. So speaking of timing, if you want to know what the value of a month is, ask a pregnant woman if a month matters in her pregnancy. And the last month usually lasts about 1,000 days. And so we still do screening in the third trimester, looking for weight gain, the maturing of the organs, but it's also time to plan the baby's room, review special requests for labor and delivery, plan the pediatric care, the room and the car seat. Moms get a lot of symptoms in pregnancy, and this is a good time to talk about these things with the care team. And of course, we want to know about bleeding, pain that worsens, decreased movements of the baby, leaking fluid, headaches, vision issues, breathing issues. All of these things are important to the care team. These is just some more pictures of what we can see now and the detail that we can see. We can actually, by ultrasound, do physical examinations of babies before they're born. They're very cute. So I'm not going to spend a lot of time about delivery, but I have yet to encounter a mom who's missed labor. And so it's education about the timing of contractions and when to come in, leakage of fluid, of course, and change in movement. And when somebody's admitted, we typically do a blood test when they come in. We start IV fluids. We meet the staff, and there's certain monitoring that happens across all pregnancies. So as far as the delivery, this is about as much as I'm going to do about the delivery. The childbirth classes don't prepare you, and they don't teach the critical skill, how to breathe, count, and swear at the same time. So we have teams that deliver at Shands at UF Health. They're physicians, midwives, and we have, of course, all of our support staff are fabulous nurses and technicians and clerks. Even the folks that do our support services for cleaning, they're all part of a very well choreographed team. Our prenatal care clinicians are physicians and midwives. We also have nurse practitioners and physician assistants who help us in that area. I do want to mention that we have just started a midwifery service at Shands. We're delighted. We started this past month, and we have an official opening for this in November 15th. And really, this is in response to enhance the care that we provide to the community. And then also, we're going to use this to contribute to our efforts to lower preterm birth rates, cesarean delivery rates, improve our patient satisfaction, shorten hospital stays, improve safety, and reduce cost of care. This is all part of an integrated approach to pregnancy care, from the least complex to the most complex. And we have many multidisciplinary programs to target care, condition-specific care, to help people navigate whatever situation they may find themselves in pregnancy. And lastly, just a few words about breastfeeding. UF Health Shands is an accredited hospital for baby-friendly designation. We're the first one in Florida to be that, to get that designation. And it is a World Health Organization initiative, and we're very proud to be part of this. And part of this, one of the core features of it is promoting breastfeeding. There are advantages, and over time, we have learned that some of these advantages are to the mom, they're also to the baby. So it improves weight loss after pregnancy because you burn a lot of calories when you breastfeed, but it also reduces some cancer risk. It reduces some risk to high blood pressure, cardiovascular disease, stroke. And for the baby, we know the risk is that it's mom's milk is the best food. It's easier to digest. It contains wonderful antibodies that protect against infection. And that these babies typically have fewer visits or illness to the pediatrician. So from just a couple of really important points, we know that annually, for moms who breastfeed, if you look at their health later in life, we know that a mom who breastfeeds for at least 6 months, that we could potentially in this country, if we had a 90% breastfeeding rate, we could prevent over 5,000 cases of breast cancer, over 22 cases of ovarian cancer, prevent over 12,000 cases of type 2 diabetes, prevent over almost 36,000 cases of hypertension, and prevent over 8,000 heart attacks. And this is in the moms later in life. Pretty remarkable and impressive. So in addition to the immediate effects to those long-term improvements for the mom, in addition to the immediate effects for the baby, the impact on the baby's long-term life is impressive as well. So we could prevent annually about 185 cases of leukemia, over 600,000 ear infections, over 271 cases of inflammatory bowel disease, over 2.5 million gastrointestinal infections, over 20,000 severe respiratory infections, over 45,000 cases of childhood obesity, and over 1,300 cases of severe bowel injury resulting in surgery and life-threatening injury. Incredibly, incredibly important, the issue of breastfeeding. And so WHO and UNICEF recommend children initiate breastfeeding in the first hour of life and exclusively breastfeed for the first 6 months of life. This is something we promote at UF. It's something we love all of our mothers to do, no matter where they deliver and what circumstance. So I just want to end here. We find the light and the beauty and the happiness of children that make the heart too big for the body. And that those children start with pregnancy. So I thank you.